Councilor Havens.
You know, this discussion is really, it's like talk about religion and politics, you just can't win. I'm sitting over here trying to figure out what would be a good argument for or against, and I really haven't come up with one. But the first thing that comes to my mind is that who sits on this council would have the guts and the courage and the fortitude as Dr. Anwar? Not one of us. Not one of us. And I thank you very much for myself and for the community. We brought this to a drinking fountain conversation maybe tomorrow morning, maybe if enough people are listening. We made them aware that there is a problem in the town of South Windsor. And if someone in Rhode Island, their headquarters of CVS, may pick up the idea that it's not a good idea to have the cigarettes at the counter, a checkout counter. And maybe if we wrote them and tell them that it might be a good idea if they re-examine the layout of their pharmacy. So, I'm a businessman. I would hate to see anybody regulate how I could do business. They try, but they can't get away with it. But in any event, if it does come down to, I don't think you can. You're not going to vote tonight, are you?
No.
Oh, that's right.
This is only a discussion item.
So that leaves me out. So it leaves me out for me to think about it. But anyhow, and unfortunately, it had tinges of politics tonight. It is kind of coincidental, though. 6 over there do not support Dr. Anwar in any way. And I didn't want to get political. That's why I kept quiet. But the 2 here are Democrats and then saw things differently about personal responsibility. And you hear so much of that on the national scene today. It's almost sickening. Really, it's an excuse to get up and talk. But anyhow, in any event, I've given it some serious thought, and I'll get back to Dr. Anwar privately. Thank you.
Thank you, Councilor Havens. Councilor Anwar.
Thank you, Mr. Mayor. I just want to make sure, I think Kathy, hopefully she's probably watching from home or she may have stepped out. Wanted to follow up on some of the remarks she made. Actually, CVS is the only pharmacy. That's why I had to put the name of CVS, because I know that that's the only pharmacy in town. And we've had this conversation back in July, the first time when we had it. So I put it there because that is the only pharmacy in town. So there's nothing wrong with that. They have to be singled out because they are selling cigarettes and they're the only pharmacy. If there are 10 other pharmacies for the 10th time, I would be asking all the 10 pharmacies not to sell cigarettes. And I think a remark was made to not that we are not focusing on what's going on with the ceilings of the school system, the sidewalks, and so on. People need to look at the minutes of the town council. They need to watch the town council meeting because they make some ignorant remarks. Who has been making the most voice sounds at various levels on all these aspects about the ceilings and also about the sidewalks? We have, as a town council, been doing it. I am amongst those voices that has been doing it. Now, just because there's an issue that needs to be addressed does not take us away from the other aspects. We've had 5-6 hour discussions in the last many weeks on the various things that the town council has passionately looked at, and we have addressed all of them, and we want to address this aspect as well. It's not taking away from anything. So again, that was the soundbite that needed to be corrected. And as far as the heart-safe community, well, we are a heart-safe community? Really? Really we are a heart-safe community? When we are allowing our pharmacists to sell cigarettes to our heart patients when they go to get their medicines? We are not a heart-safe community. Well, we may have a title, we may have a sign on the wall, and I challenge us, we are not truly a heart-safe community just because we have a sign on the wall that's saying that we are. We need to do more about it. We're just stopping at a point and we're saying, well, after that it's a free rein to everybody else to do what they want as a business and so on. That's not how it is. If you want to be a heart-safe community, do more. As far as the challenge that she has said, well, I've been doing it. That's my job as a lung doctor, to be able to reach out to the people who are having problems, to reach out to them. Have we been able to do it at the school system? Well, if the school system would give us permission, we'd love to tell the children in the school system. I hope through our discussion today, the families are going to go and tell their children, you cannot smoke. If anyone can take anything from our discussion today, if people can understand to have this conversation with the children about the health hazards of the various things that are out there, that would be worthwhile. I think that's something that we should look at, and I take that challenge up, and if the the Board of Ed and the superintendent would allow us, we would love to have this conversation with our children in our community because it is very much needed. Thank you, Mr. Mayor.
You're welcome.